What is the recommended daily intake of sodium?
1500 milligrams. What is the role of sodium?
Maintains fluid and electrolyte balance, supports muscle contraction and nerve impulse transmissions. What are food sources of sodium?
Salt, soy sauce, bread, milk, meats. What are deficiency symptoms of sodium?
Dehydration, low blood sugar, heart palpitations, muscle cramps, weakness or lethargy, confusion or disorientation, slurred speech, nausea, seizures, coma, or death in extreme cases if left untreated. What is the recommended daily intake of chlorine?
2300 milligrams. What is the role of chlorine?
Maintains fluid and electrolyte balance, aids in digestion. What are food sources of chlorine?
Salt, soy sauce, milk, eggs, meats. What are deficiency symptoms of chlorine?
Loss of appetite, muscle weakness, lethargy, dehydration. Deficiency leads to alkalosis, a condition in which body fluids have excess base alkali that can result in dangerously high blood pH and excessive loss of potassium in urine, which in turn causes hypokalemic metabolic alkalosis with symptoms that include loss of control of muscle function, which might lead to breathing and swallowing difficulties. What is the recommended daily intake of potassium?
4700 milligrams. What is the role of potassium?
Maintains fluid and electrolyte balance, cell integrity, muscle contractions and nerve impulse transmission. What are food sources of potassium?
Potatoes, acorn squash, artichoke, spinach, broccoli, carrots, green beans, tomato juice, avocado, grapefruit juice, watermelon, banana, strawberries, cod, milk. What are deficiency symptoms of potassium?
Acne, constipation, depression, edema, excessive water consumption, fatigue, glucose intolerance, high cholesterol levels, insomnia, mental impairment, muscle weakness, nervousness, poor reflexes. What is the recommended daily intake of calcium?
1000 milligrams. What is the role of calcium?
Formation of bones and teeth, supports blood clotting. What are food sources of calcium?
Milk, yogurt, cheddar cheese, Swiss cheese, tofu, sardines, green beans, spinach, broccoli. What are deficiency symptoms of calcium?
Brittle nails, cramps, delusions, depression, insomnia, irritability, osteoporosis, palpitations, periodontal disease, rickets, tooth decay. What is the recommended daily intake of phosphorus?
700 milligrams. What is the role of phosphorus?
Formation of cells, bones and teeth, maintains acid-base balance. What are food sources of phosphorus?
All animal foods, meats, fish, poultry, eggs, milk. What are deficiency symptoms of phosphorus?
poor bone formation and growth, impaired bone mineralization that causes rickets in children, softening of bones that result in skeletal problems such as knock knees, bowed legs, spinal curvature, narrowed chest, and soft skull bones, osteomalacia, adult rickets that causes bones to be soft and prone to fractures, and symptomized by deformities in the spine and limbs. And rheumatic or arthritic-like pain, numbness and tingling of the extremities, hands, and feet, difficulty walking, increased susceptibility to infection, fatigue or muscle weakness, anemia, loss of appetite and changes to weight. What is the recommended daily intake of magnesium?
420 milligrams. What is the role of magnesium?
Supports bone mineralization, protein building, muscular contraction, nerve impulse transmission, immunity. What are food sources of magnesium?
Spinach, broccoli, artichokes, green beans, tomato juice, navy beans, pinto beans, black-eyed peas, sunflower seeds, tofu, cashews, halibut. What are deficiency symptoms of magnesium?
Anxiety, confusion, heart attack, hyperactivity, insomnia, nervousness, muscular irritability, restlessness, weakness. What is the recommended daily intake of iron?
8 milligrams. What is the role of iron?
Part of the protein hemoglobin, carries oxygen throughout body cells. What are food sources of iron?
Artichoke, parsley, spinach, broccoli, green beans, tomato juice, tofu, clams, shrimp, beef liver. What are deficiency symptoms of iron?
Anemia, brittle nails, confusion, constipation, depression, dizziness, fatigue, headaches, inflamed tongue, mouth lesions. What is the recommended daily intake of zinc?
11 milligrams. What is the role of zinc?
A part of many enzymes, involved in production of genetic material and proteins, transports vitamin A, taste perception, wound healing, sperm production and the normal development of the fetus. What are food sources of zinc?
Spinach, broccoli, green peas, green beans, tomato juice, lentils, oysters, shrimp, crab, turkey, dark meat, lean ham, lean ground beef, lean sirloin steak, plain yogurt, Swiss cheese, tofu, ricotta cheese. What are deficiency symptoms of zinc?
Acne, amnesia, apathy, brittle nails, delayed sexual maturity, depression, diarrhea, eczema, fatigue, growth impairment, hair loss, high cholesterol levels, immune impairment, impotence, irritability, lethargy, loss of appetite, loss of sense of taste, low stomach acid, male infertility, memory impairment, night blindness, paranoia, white spots on nails, wound healing impairment. What is the recommended daily intake of selenium?
55 micrograms. What is the role of selenium?
Antioxidant. Works with vitamin E, to protect body from oxidation. What are food sources of selenium?
Seafood, meats and grains. What are deficiency symptoms of selenium?
Growth impairment, high cholesterol levels, increased incidence of cancer, pancreatic insufficiency, inability to secrete adequate amounts of digestive enzymes, immune impairment, liver impairment, male sterility. What is the recommended daily intake of iodine?
150 micrograms. What is the role of iodine?
Component of thyroid hormones that help regulate growth, development and metabolic rate. What are food sources of iodine?
Salt, seafood, bread, milk, cheese. What are deficiency symptoms of iodine?
Cretinism, fatigue, hyperthyroidism, weight gain. What is the recommended daily intake of copper?
900 micrograms. What is the role of copper?
Necessary for the absorption and utilization of iron, supports formation of hemoglobin and several enzymes. What are food sources of copper?
Meats, water. What are deficiency symptoms of copper?
Anemia, arterial damage, depression, diarrhea, fatigue, fragile bones, hair loss, hyperthyroidism, weakness. What is the recommended daily intake of manganese?
2.3 milligrams. What is the role of manganese?
Facilitates many cell processes. What are food sources of manganese?
Widespread in foods. What are deficiency symptoms of manganese?
Atherosclerosis, dizziness, elevated cholesterol, glucose intolerance, hearing loss, loss of muscle control, ringing in ears. What is the recommended daily intake of fluoride?
3.8 milligrams. What is the role of fluoride?
Involved in the formation of bones and teeth, helps to make teeth resistant to decay. What are food sources of fluoride?
Fluoridated drinking water, tea, seafood. What are deficiency symptoms of fluoride?
Insulin resistance or glucose intolerance, where cells in the body become resistant to the effects of insulin in pushing glucose from the blood across cell membranes into cells, which affects the ability of insulin to regulate blood sugar, and means higher amounts of insulin are needed, leads to high blood sugar levels that may result in type 2 diabetes in older people, elevated blood insulin levels, hyperinsulinemia, high LDL cholesterol, low HDL cholesterol levels, and/or high triglyceride levels, all of which increase the risk of heart disease, high blood pressure. What is the recommended daily intake of chromium?
20 to 200 micrograms. What is the role of chromium?
Associated with insulin, and is required for the release of energy from glucose. What are food sources of chromium?
Vegetable oils, liver, brewer's yeast, whole grains, cheese, nuts. What are deficiency symptoms of chromium?
Anxiety, fatigue, glucose intolerance, adult onset diabetes. What is the recommended daily intake of molybdenum?
45 micrograms. What is the role of molybdenum?
Facilitates many cell processes. What are food sources of molybdenum?
Legumes, organ meats. What are deficiency symptoms of molybdenum?
increased respiratory or heart rate, night blindness, difficulty with seeing in the dark, mouth and gum disorders, sexual impotence in older males, sulfite sensitivity. If molybdenum level is not enough for detoxification,